Do we like Serena? Welcome back to Body Beautiful. We're talking about mommy makeovers with Mother's Day coming up, early part of May 9th. We're with Dr. Elizabeth Lee. And first, let me remind you that we'll be taking your calls live with any questions you have for the doctor. The phone number is 800-440-4884. We'll also be posting the number for Dr. Lee's office during and at the end of the segment. And any advice we give you today, you certainly want a second opinion. Let's go ahead and go to the phone lines. Vicki from Richmond, good morning.
Hi.
Hi. Do you have a question for the doctor?
Yes, I'd like to know what the recovery time is for tummy tuck and if your age has anything to do with the time of recovery.
That's a great question. Age, if your health is good, doesn't really have a whole lot to do with the recovery time. And what I say to patients is that they should plan on taking a full 2 weeks off of a desk job. Then there's a 6-week period of time where your body's going to be healing and you need more sleep. So you shouldn't plan big projects right after the tummy tuck. And patients do remarkably well with this.
Okay. Is there any age limit? Somebody, you know, where you won't?
I've actually done abdominoplasty on a woman in her 60s, and she was remarkable. 4 days after the surgery, she walked the 2 miles from her house to her appointment. She's really the outlier. She did really well, but there's no absolute age cutoff. It really depends on health and on indications for the surgery.
Okay, thanks, Vicki. Like your name. Moving on to Serena from Castro Valley. Good morning, Serena.
Good morning. I have a friend, and I know she's watching, but she has had a baby 2 months ago, and she's scheduled to get a tummy tuck and lipo. And so I want you to kind of tell her what the complications might be and how that could be dangerous.
She's getting a tummy tuck 2 months after her surgery, after her delivery?
Yes.
Well, you know, it's hard for me to give medical advice without actually seeing the patient, but based on what I said at the beginning of the show, there would have to be significant reasons to do it so quickly. And you know, any surgery has complications. They should be relatively low risk. We are doing elective surgery, so we do not expect there to be major complications, but there could be. And I would just really, anybody coming into my office 2 months after delivery, I would talk to figure out what the real rush is, because where her body is now may not be where it ends up in 9 months. So I would be hesitant to say absolutely jump in and do it, unless, as I stated before, it was the kind of situation where it was a scheduled C-section, the last baby, everything was stretched out beforehand, and so we get one recovery period with the delivery and the baby, and then there are advantages to doing it that quickly.
All right, Serena, thanks for the question. You're a good friend, and hopefully you'll pass on that advice. Always better to be safe than sorry.
Absolutely. I mean, you know, plastic surgery and aesthetic surgery are really non-medically indicated procedures. They have to be done in the safest fashion possible, and the risks need to be minimized.
She did mention liposuction. Do you sometimes just do the lipo without?
Yes, liposuction is an appropriate procedure when all there is fat underneath the skin that patients just can't get rid of. But liposuction is probably not an appropriate procedure if there's separation of the muscles, or if the skin is very loose and has a lot of stretch marks, because liposuction will take fat out, it'll make you smaller in inches, but it's not necessarily great to have all that extra loose skin hanging out.
Okay, you mentioned stretch marks, and that's a big complaint of women who've you know, been pregnant.
Right.
Can you get rid of the stretch marks, or what do you do?
You can't really get rid of stretch marks. You know, there's all these new laser technologies and infrared technologies that claim that they can, but basically stretch marks are scars. They're where the deep layer of the skin has torn because things grew too fast. And those scars, we can't do anything about scars, but if you have lower abdominal stretch marks, like below the belly button, and stretched out skin, and that's what you're looking at improving with the tummy tuck, those stretch marks below the belly button will come out as that extra skin comes out.
Okay, and so these are multiple procedures. Do you do them simultaneously?
Yes.
And do you advise that?
Well, it depends. I mean, the advantage of doing them at the same time is that there's one recovery time, and that, you know, so as we have young mothers mothers, working mothers, people who have to make arrangements for childcare, for time off of work, if they're healthy enough to undergo this amount of surgery, it's nice to get everything done at the same time because it's one shot.
Okay, we've got a lot of phone calls we want to get to. We need to take a quick break, but for more information about Dr. Lee and Mommy Makeovers, you can call 510-704-2170 or check her out on the web at artfulsurgery.com. And when we come back on Body Beautiful, we'll continue our chat about Mommy Makeovers, and then we'll take more of your phone calls.